Third question. In your opinion, what were the defects in the administration's healthcare plan? And what changes would you suggest to improve it? And perhaps some of the questions said maybe touch upon tort reform.
Another really important question. What are the problems with healthcare, with the Obamacare, as I would call it? Well, first off, it's not healthcare reform, it's a healthcare takeover. I read H.R. 3200 from the very first word to the very last word. It's not just a takeover of the healthcare industry. In there, it's a takeover of the doctors, of the hospitals, of the extended care facilities. It is a monstrosity from the beginning. The premier of Newfoundland and Halifax just came to the United States for open heart surgery. Can you imagine that? Can you imagine the President of the United States going to another country for heart surgery? Now you see my brother-in-law here, and he does heart surgery. I mean, there's nothing there that can do that. So we have the best health care in the world today. What they want to do is they want to change it. Perhaps we should find out why people aren't flocking to Nicaragua or Honduras or any other country for their health care and why everybody comes here. Thank you.
The problem with health care is not the care. It's the finest in the world. It's the health. If you consider that 50% of all funds are spent in the last 2 years of one's life, one starts to consider there may be programs for prevention in diabetes, obesity, smoking, Alzheimer's disease, and things that would make a difference as far as total cost. Defensive medicine accounts for approximately $58 billion a year. $58 billion a year, mostly from the Medicare fund, which funds our senior citizens who worked hard and are entitled to and deserve it. If we were able to buy our policies and make them portable across state lines, that would save on cost also. The electronic medical record, with preventing the redundancy of testing, would also result in savings. And if we want to improve health care, let's not tax people who have great health plans. In addition, you want more people to be covered with health care? You grow the economy, you cut the taxes, create jobs. 72% of all Americans receive their benefits based on private employment.
In a Rasmussen survey, it came out that 85% of Americans are satisfied with our current health care. And all this hullabaloo is about 30 million people who are not covered through their own choice, either that or they're illegal aliens or they slip through the cracks. Now, I know we can make it better. Healthcare does need reform, but not with a 2,000-page bill, which no one has read. I think this creates a government monstrosity, a big bureaucracy, and there's a better free market ways to do it, which the other candidates have elaborated on. The main thing is tort reform and have catastrophic insurance. So you're not running to the doctor for every hangnail you have. Thank you.
Once again, we get back to the Constitution, you know, that piece of paper that we put our hand on the Bible to uphold. If you look at Article 1, Section 8, health care is not one of the enumerated powers. So it doesn't matter whether I think it's a good plan or a bad plan. The government has no power to stick their nose into people's health care. Get the government out of the way. Do what the Constitution said is permissible for the government to do. Everything else, people will be free from taxes and they'll have money for their own health care. Period. End of story.
There's so much wrong with this health care bill that I could go way over that minute of time. There's a healthcare commissioner who will be making choices for people under the House healthcare bill, which incidentally I read. There is also unconstitutional taxation, taxing people, penalizing people for not having health insurance, which is just an outrage, certainly not in Article 1, Section 8 of the Constitution, and not totally impermissible. The solutions are obvious. The solutions include allowing people to purchase their health care across state lines, having high deductible health care plans along with health savings accounts, most efficient way to insure people. Unfortunately, the health care bill penalizes the health savings account. It has caps on the health savings accounts. It does exactly the opposite of what it should be doing. And you have 20% penalties if you take money out, so it's disadvantaged. The health savings accounts are now disadvantaged versus an IRA or anything else that you might put your money in. I'm sorry, is my time up? I could speak for another 10 minutes at least about this. Thank you.
Thank you.
Like I said, I've also gone through it, not me, my lawyer. He went through it, and he explained to me, and it is a horrible situation. But I think what upset most of us is all these backroom deals, the Louisiana Purchase. Where was all this transparency? You know, and this would upset me. The Louisiana Purchase, the Ben Nelson deals and all that. This would upset me. It was all done behind closed doors, and I wanted all this change. This change was nothing. It was done secretively, and this is what I didn't like. I know all the things that are wrong, but you know what? I got to pay $13,000 for my people to have health insurance, okay? I can get it cheaper in other things, like many of my colleagues have said, I cross state lines, I can find deductibles, but the basic thing is, we can all find better. We're not stupid Americans. We can go online and get policy. You know why your car insurance is cheaper? Because you can cross state lines and you can get a deductible. And if you're humble with the doctor, he'll give you a break. That's a pretty good Jewish word from a guy, huh? Not bad.
Thank you.